Now I'll be assessing range of motion of the knee. So I'll have the patient raise their leg up actively into extension, and then I'll have them come back down into flexion as far as they can go. Can I have you stand up for this? So here, going into active flexion, bring your leg back as far as you can. All right. So now I'm going to have you set up on the table. And can I have you, in here, go ahead, and I'm going to bring you into extension. Just let me bring you into it. All right, so I know the infield. I'm comparing bilaterally. And now I'm going to have them push against me and go into extension, applying resistive. Now can I have you lay on your stomach? So here I'll be assessing flexion, so passive. I'll have them come all the way up. All right, and then in this position, I'll have you come against my force. Come on, come on, come on. Come on, keep going. All right. And that's active, passive, and resistive range of motion at the knee. Now can I have you roll back over onto your back? And from here, I'll be assessing patella range of motion. So here I have lateral and medial shifting. I have anterior translation of the patella and posterior translation of patella. So you can really get the joint play going along with it. So for this video, I'll be doing lateral palpations of the knee. To start, I'm gonna do the lateral joint line, which you can palpate with your thumb. From there, I'll go down to the fibular head, which you can also manipulate and move it around. From there, also, we have the LCL, which can be palpated between the joint lines. You have the femoral epicondyle and the supracondyle. You also have in the quad, you have your IT band that runs all the way up to the greater trochanter. At the insertion of the IT band, you have your Gerdy's tubercle. And you also have in the posterior aspects, but it's also in the lateral side, you have the popliteus muscle that runs underneath. In this video, I'll be assessing knee girth measurements. To start out, I'm going to place a landmark right at the tibial tuberosity, which I can palpate. From there, I'm going to measure the same distance so I can make sure that I'm being reliable with my measurements. I'm going to do 5 centimeters each one. After I have my landmarks, I'm then going to measure them in centimeters. So having the patient relax. At the tibial tuberosity, he's 36 centimeters. Across the patella, 36. Above the patella, he is at 40. And then into the quad at 44. So now I'll be assessing valgus and varus stress testing. I'll have the patient sitting like this. I'm then gonna hold the patient by their foot and stabilize at the thigh. And from here, I'm gonna be applying a valgus force, trying to really stretch the MCL. From there, I then have them relax for me, go into 30 degrees and do the same, trying to stretch at the capsule. For varus testing, I'll be going on the medial aspects, doing the same thing, holding the leg. I'll be applying stress at the LCL, looking for laxity and pain, and then flex at 30 and doing the same, looking for any sort of laxity. I'd also ask the patient while doing that test if there's any pain or discomfort. I will be doing the anterior drawer testing for the integrity of the ACL. I'll have my patient sitting on their back and knee flexion. From here, I'm gonna get into the joint line and I'm gonna put my thumbs in the joint line of the knee. And from here, I'll have them relax. Sometimes you might have to massage them to get them to relax. From here, I'll be applying an anterior force, looking for any laxity or pain and discomfort with this test. With this patient in this position already, I can do the posterior drawer test, which is testing the integrity of the PCL. from here, I'll be doing the same position with my hands, and I'll be applying a posterior force, looking for any give and laxity. Also asking my patient if they have any pain or discomfort with that as well. So this test is the Thessaly's test. This is testing for meniscus tear or meniscal injuries. So with this test, I'll have my patient hold my hands for support, and I'll have them go into a single leg stance with slight knee flexion. And then from here, I'm gonna have you rotate and turn. Is there any pain or discomfort with that?
Nope.
All right, with that, you're looking for pain, discomfort, any valgus drop forces in the knee, or any other indications of a meniscal tear.